Hi, this is Dr. Andy's daily COVID tip. So tip number one, this tip is know what will make you a contact. Now you want to know what will make you a contact because a contact is what could put you in quarantine. So let's talk about what that means, a contact, and why we're talking about it. Now, one of the reasons I'm talking about it is because of a recent article I heard about today, and I looked up and was pretty straightforward, pretty good article. Talked about contaminated surfaces and how the CDC had recently downgraded their concern about contaminated surfaces. So let's talk about that. Before we get to that, I want to talk about what makes us at risk for getting this disease. And so if on a scale of 1 to 10, 1 means I'm not worried about that activity causing me to get the disease, and 10 means I'm very worried about that. The highest risk, the worst problem would be if I had repeated direct contact, okay? Repeated direct contact, that puts me at very high risk of getting the disease if I have repeated direct contact with someone who's sick. So I'm going to give that a 10. Now what about if it was intermittent but direct contact? Not as high risk if we just have some direct contact but not on a regular routine or daily basis, or just a one-time, for example. Maybe that would be right here below one-time contact. I'd put that at about an 8. Now when I get down here to around 6, that's what I would call prolonged close contact. Wouldn't be direct, but close. And what do I mean by prolonged and close? If I look at what the CDC says about this and how they help define contacts, what you see most commonly is they say greater than 10 minutes and within 6 feet. And those are usually the definitions that are used to say this person has been in prolonged close contact. Now, when we move down, where would we put then touching a contaminated surface? And I'd say that before we knew real well and we were concerned and trying to figure out how people got it, the CDC, by the criteria, I'd say generally we probably would have thought it around here, about a 4, touching a contaminated surface. Now, with more epidemiology, meaning more research that shows how people are getting the disease and where, we're a little less concerned about that, I'd say. And the CDC's language has recently changed a bit, and said outright, we don't think this is a primary way it's spread. It's not a huge change, to be honest, in the way we're thinking, but it may have downgraded it a bit. So I'd say maybe it's down here at a 2 or a 3, touching a contaminated surface. Okay? So if I touched a surface that an ill person, an infected person touched, then it's not that there's no risk. It's not a smiley face. There's still some risk, but it's not super concerned. Now the big distinction here, and the reason why this change here may not be incredibly significant, but it's helpful, right? It helps us know where to focus our concern. Is that what we consider a contact would be this stuff up here. Prolonged close contact or more. That is an individual that if that has happened with a sick person, we would say they should be in quarantine. Down here, we're not saying there's no risk, but it's not bad enough that we expect them, that they could get sick, and so we put them in quarantine. So these are the kinds of activities that could put you in quarantine. And of course at the time, the person might not even be ill, they might not feel ill. It could happen that within the next couple days they get sick. So that's why we have all this. The primary way of helping prevent the spread of this is through physical distance from others, 6 feet, and through washing our hands so that we don't get anything from that contact. That's secondarily to help with this, touching contaminated surfaces, right? So we still want to prevent, but if this were to happen, it wouldn't automatically put us in a contact. Now, depending on the circumstances, if a public health, a contact tracer felt that the circumstances were pretty bad, they may still recommend quarantine. But generally speaking, this is what says, yep, you are now considered a contact. So that's your daily tip about COVID-19 from Dr. Andy.